This is the One Thing Podcast, and I'm your host, Dr. Adam Rindy. The One Thing Podcast brings together leaders in functional and naturopathic medicine to discuss actionable information that may unlock puzzles in the areas of gut health, brain health, metabolism, and longevity. Please note, these episodes do not replace the opinion of your doctor. They are not intended to diagnose or treat any condition. Please discuss this information with your provider and discuss your own unique personal health history before adapting this information. Please subscribe to our episodes so that you can stay on top of the most current information in these areas of medicine. In this episode, I'm just going to share some daily insights that I have from practice. Oftentimes, people will wonder whether they should choose a conventional medication versus a natural approach towards treatment. This decision is quite complex as it includes concepts such as personal philosophy and values, and how much that weighs against evidence that might be presented for this particular decision. Also, general philosophies, whether or not one person believes in more of an allopathic approach versus a holistic approach, weighs into these decisions. Holistic approaches generally think about the body as a organized and communicating system where the organs interface with other organs in the body. For example, the digestive tract interfacing with the brain, also the digestive tract interfacing with the liver. Whereas allopathic approaches generally look at targeting the primary organ or system involved instead of including other systems or downstream or upstream from the system of interest in the therapeutic approach. This commentary really is not intended to argue against or for one or the other, as both have their place. There are other layers to this issue, such as how will one tolerate a particular treatment versus the other. And interestingly enough, it's not always the naturopathic or natural medicines that are more tolerable than the conventional medications. I'll give you an example. Many patients of mine will have sensitivities to chemicals that are in plants or foods, such as salicylates, and sometimes chemicals or compounds that grow on plants, such as molds or mycotoxins. Depending on the particular herb or supplement or compound of interest, they may have more of a reaction to that particular supplement or compound than they would having a reaction to a synthetic medication. So you can see the complexity of deciding whether or not one would choose a naturopathic or conventional approach is not as straightforward as one would seem. Finally, there's another concept to this. Naturopathic medicines or natural medicines are often involving more complex effort and organization and compliance schemes than a conventional medication. Take a one-a-day pill that is covered by insurance and compare it to a 4-supplement protocol that is not covered by insurance, requiring a participant to take it 2 to 3 times a day and also incorporate diet and lifestyle changes into that protocol. Simply put, there has to be enough gas in the tank to follow a naturopathic protocol versus a conventional protocol, which may be a easier treatment to comply to and more affordable. So I don't take these decisions lightly when I'm speaking with my patients. I weigh all of these factors and try to present a pros and cons scenario. And at the end of the day, outcome is the most important thing, and even better, outcome with the fewest amount of side effects and the fewest amount of factors impacted on one's life is important to weigh into these decisions. It's important for us not to be zealous about naturopathic versus allopathic decisions. We should really sit back and look at the person sitting in front of us and their current functional capacities, limitations, and abilities. And at the end of the day, if one weighs out in favor of the other, we should make decisions based on that. It just so happens that without presenting naturopathic therapies in this decision, we are overlooking many situations where the naturopathic or natural medicine way is more favorable than the allopathic way. Vice versa, if we get too pigeonholed into covering the naturopathic therapies and looking at them in a too much of a favorable light versus allopathic therapies, then we may be overlooking a better choice for the patient. Thank you for tuning in. This is Dr. Rindy, and I appreciate you listening to my insight. Thank you so much for tuning in to this week's episode of the One Thing Podcast. Please share these episodes with your friends, loved ones, colleagues, patients, healthcare providers, anyone who you feel might benefit from hearing these informative interviews. We tend to learn best from people sharing things with us. That's often the first time it's introduced. So don't hesitate if the content of these episodes reminded you of someone that might benefit from it. Forward the episode to them, and I'm sure they'll either appreciate it or be appreciative that you've thought of them. So once again, we'll look forward to seeing you next episode on the One Thing Podcast. And again, much appreciation for you being here with me.